And welcome back to the morning show. Time to talk with Gary Shapiro, Southwest Financial. Good morning.
Morning.
How are you?
Very good.
Really good to see you. How you been?
Great to see you. Very, very well.
Yeah, the throats, they sound great.
Everything worked itself out.
Isn't that fantastic?
Happy.
Congratulations.
Happy. Thank you. Thank you.
Dodged a bullet on that one, buddy.
Yes, I did, and feeling better that I took care of everything that needed to be taken care of this year. Yeah. So
I'm glad.
Yeah.
And you still have all 10 of your fingers.
Absolutely. Good.
And
good.
10 toes.
Good specialist.
Absolutely. So what's going on with business?
This is
Insurance.
the time of year for health insurance, annual enrollment period. There's two back to back, right? We've got Medicare annual enrollment period we're into right now. Started October 15th through to December 7th. So that's Medicare. Those that have Medicare and supplement plans like yourself.
Right.
And especially for those that have Medicare Advantage plans. Starting November, we're looking at the annual enrollment period for the ObamaCare, as they say, federal marketplace. Right. Lots of big changes there this year, especially locally. So, you know, everybody knows it's on shaky grounds.
Right.
Especially for those here locally, Mojave County, Arizona generally, and, you know, nationally, there's an awful lot. I think it's at least 37 states that 2 or 3 of the major health insurance companies have just pulled out totally of the market.
Oh my gosh, really?
Mojave County, it's already official, and again, we're talking about ObamaCare, the online marketplace. There's one insurance company left for Mojave County. That's it. And it's really tough to you know, let people know that, on top of the fact that the insurance companies have pretty much written off the agents in the process. We're no longer really part of the process officially. So, you know, those that have been on and need assistance, you know, we're definitely there for you still, because you're our customers. We want to make sure that you're updated, you have choice of plan, because there are changes of plans as well.
Sure.
So really it's just Blue Cross anymore, but there's nothing in there for the agents. So you have the choice of either calling the navigators on the marketplace 800 number, nonprofits locally, Western Arizona Regional, the hospital, they have an office there to help people, and North Country Healthcare, you know, also nonprofits to help people. But we find, you know, 8-9 times out of 10 when people have gone elsewhere, they come to us because we know health insurance. So we're not going to tell people, you know, just go somewhere else, we can't help you. We're not.
Here's the deal. The big announcement's going to be right here on the morning show on November 1st, Tuesday, November 1st. Gary will be back in here and completely give us details on that at this point in time. He cannot, but on the 1st, he will. Right. So be sure and tune in.
And so, you know, that brings us to the next market, which is the Medicare market. And you're totally fine with Medicare supplement insurance plans and original Medicare. I don't think anything's going to happen even within the next election as far as that goes. Medicare Advantage plans, therein lies the crux. Every year, we always tell people and our customers to call, get to the latest plans, get to the changes. You know, we have seminars at the Bullhead City Library, you know, on Saturday, some Friday coming up November. And, you know, the Center for Medicare and Medicaid Services, we can't right now, we can't say anything, so November 1st I'll be back. My strongest urging at this time, since we're in annual enrollment period, is for everybody, not just our own customers, everybody locally to call and, you know, find out specifically one-on-one. We could tell you what the latest news is that affects everybody in Mojave County. And we'd be more than happy to spend time with you, whether or not you've either, you know, been in that market directly or with somebody else that's come up from Phoenix, whatever. More than happy to sit with you. We're here all year long. We're here to help you. We really want to be of service. It's really going to be important this year with Medicare.
Now, just a quick question. If someone is not yet 65, they're 64, they'll be turning 65, let's say in February or March.
Sure.
They can sign up now, can they not, for Medicare?
Yes, that's true.
And have everything ready to go.
Sure. Yeah.
Up to 6 months, you're saying?
Yeah, it's the best thing to do is somewhere 6 months before you actually turn age 65, go into the Social Security office, make sure that you're signed up for Medicare. and then come into the office, around 3 months before that you're aging in, and let's make sure that we get you sorted out as to what your choices are, because there's an awful lot of choices and an awful lot of rationale between which way to go, how to take care of yourself with health insurance and Medicare.
So the first time you apply for it at 65, you can pretty much pick and choose when you go in.
Right.
However, after you turn 65 and you have it, then you're limited to that little window, that narrow window around the first of the year. To do any changes.
Annual enrollment period to make any changes, unless you've moved and things like that. There's some special election periods that, if you move from Laughlin to Bullhead City, if you move from Bullhead City down to Phoenix, you may have to make new plan choices, right? There's certain election periods special if you're on a low-income subsidy, government assistance for prescriptions and other things. And those that qualify for Medicaid and are on Medicare, I've got somebody this afternoon coming in, there's special plans for that. That's different from your regular Medicare all-in-one plan. So there's an awful lot behind all that,
and not everybody out there who is not, if you're not in the business, it's hard to know what's going on. Obviously, there's a lot of big changes coming up, and obviously there's a lot of things you need to know about. So if you're a person like me who doesn't have a lot of understanding of all this, then you got to ask a professional. That would be Gary and his staff at Southwest Financial.
Right. You've met Jennifer the last month or two.
She's been on the show here, yeah. Great gal.
She's just amazing with all this information. Up to date. We get our, education credits and all that, and then some. Either way, either one of us are there all year long to help people.
That's fantastic.
And we really like to do that.
It's just really unfortunate the government is treating you like that, to where they're taking away all incentives or anything else. And
government and insurance companies, and what's behind that, and there's an awful lot of power play going on in Washington, and that's a lot. It would take another 15 minutes to discuss why those things go on, and then we're subject to whatever that bottom line is and whatever choices we have here locally.
Wow.
And, it gets to a point where, okay, this is what our options are. This is the best you could do. A, B, C, or D. Let's get to it and make good choices.
Absolutely.
At this point,
So all you need to do is go down and see Gary, Southwest Financial Center on Highway 95. There's the address and phone number right in front of you. That is the right phone number, right?
That's it. 763-4360.
There you have it.
Right.
Gary, thanks for being here, buddy.
Okay, pleasure. We'll see you again soon.
Anytime.
All right.
Gary Shapiro, ladies and gentlemen. Do not forget, he'll be back with us on November 1st to bring you a special, very special and important message. So be sure and be with us. We'll be back with more of the morning show right after this. Stay there.
All right.